Hi, Dr. Joe here to report a little bit on some of the machines that we have used for several years with reference to measuring blood pressure. It's way more than blood pressure today. The concept of going and putting this little thing in your arm, going pump, 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 and getting an accurate measurement of your blood pressure over your entire body is wrong. We'll go into it later why it's wrong, but it basically is only measuring everything below where the cuff is. Not your head, not your heart, not the rest of your body. So it's a very important thing to start off with in terms of what we have to learn about this is what we call small vessels in the whole system, your whole body. The small vessels are called C1 and C2, and in that category, the C1 is the larger artery and the C2 is the smaller. They are both really microscopic. When first this was invented in 1980, it was a situation where they thought they were measuring a lot of the aortic values. Aorta being the largest blood vessel, comes out of your heart, goes up, and then turns around and goes down your back and spins off all the rest of the blood vessels needed for your head, your lungs, everything else that needs blood vessels. We use this because it was invented at the University of Minnesota where all this began, and it also has been used in Stanford's research that's done. If you want to publish a paper about hypertension in the world today, you've got to use waveform analysis. And there are several kinds, and we'll talk about the two principal ones we'll want. It gives a waveform. The waveform is interesting to know what that's all about because the first person to tell me in a way that I could understand it and explain it to you is they said, oh, just like the catalytic converter. And he said, well, look, you have a catalytic converter. You got to have it free of debris inside, things that fill up in the inside of your converter, your muffler, if you will. And it does clog with more debris in there, more coating that makes it ineffective at getting rid of smog. Fine. So what is this all about then? Well, they put a little device up there, and it is a waveform. It's heat in this case. It's gases from the engine that are coming out that are being measured electronically. That's just exactly what we do looking at your arm, looking at your blood pressure. So it is like the catalytic converter. And like the catalytic converter, when it gets clogged, and like your arteries, when they get clogged, that's not good. And so that this enables to see what it is, measure it. With other things that we look at, it's as if you're having a cardiac catheterization, as said by the FDA. We can figure plaque as well as inelasticity of age. This is really interesting. This is something we can make diagnoses with. We go with the small vessels, and if we see the smallest of the small, we know that small vessel disease is probably part of everything that we worry about in terms of diabetes, other vascular disease, and you have specific treatments that work on small vessels. All this is new. This is very good. We've been very successful, and I'll go in larger detail as we go through this and talk about the rest. When you get done, I think you'll like it. It'll be your time.